In my opinion, testosterone is greatly overrated when it comes to treating erectile dysfunction. In January, a new Cochrane review was released, supporting my impression, but at the same time, another large review found some benefits for men with testosterone deficiency. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. I have examined many men with erectile dysfunction during the past years, and some of them presented with low testosterone levels. The guidelines support testosterone replacement therapy in these men if they also present with symptoms. We know from the evidence that PDE5 inhibitors such as Viagra or Cialis are more effective in men with normal levels of testosterone. So there is a reason to raise testosterone to normal levels. But does it have any effect on erectile function? I find the results rather disappointing. Most of my patients don't improve. In January, a Cochrane review looked into that question. They gathered data of 11,419 men from 43 studies. The International Index of Erectile Function was used to define clinical success. A difference of 4 points was considered significant here. The IIEF is a questionnaire about erectile function. Testosterone replacement therapy increased the IIEF results slightly, but only by 2.4 points. So replacing testosterone didn't result in a clinically meaningful improvement. Neither did they notice improvements in general sexual quality of life. It was difficult to get long-term data. Most of the studies ended after 12 months at the latest, so it remains unknown whether benefits will show up on the long run. Almost on the same day as the Cochrane review, a quite similar article was published including 28 randomized controlled trials and 3,461 men with late-onset hypogonadism. They found a difference of 3.26 points in IIEF scores regarding erectile function during testosterone replacement. So this is still not 4 points. For Cochrane standards, the result would still be negative. However, the authors of that study came to the conclusion that this difference represented a notable improvement. I think it all depends on where you start off. If you suffer from severe or even moderate erectile dysfunction, 2 or 3 points will be an improvement, but most of you won't be satisfied with that because it wouldn't affect your performance. However, in men with very mild erectile dysfunction, 2 to 3 points would make a huge difference. What they didn't look into was testosterone levels. Most studies wouldn't mention them, but I think it is important if testosterone is only slightly decreased or if it is massively decreased. Most of my patients have only slightly decreased testosterone levels around 10 to 11 nanomoles per liter. Within this range, I almost never see improvements in erectile function during testosterone replacement therapy. In other words, far too much is expected of testosterone. And this applies especially when we look into the normal range. It doesn't matter whether you are on the lower or upper end of that range. Normal is normal. You won't be able to feel differences within that range. Thanks for watching. Bye-bye.